All right, welcome back to ABA exam review and our latest set of BCBA exam practice questions, where we're going through the next set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Check out behavioranalyststudy.com for all of our study materials, including our combo pack. As always, when you pass, let us know so we can include you in our Sunday shout out. Work hard, study hard. Let's get going. A behavior analyst is contracted out by a group of child care centers. At the end of the year, the analyst gets together with the owners and managers to plan the following year. The owners and managers tell the analyst that they would like to incorporate more choices for the learners in the upcoming year. What reinforcement schedule should the analyst recommend? All right, so we have a reinforcement schedule question. On the BCBA and BCABA exam, you need to know both compound schedules and basic schedules because compound schedules are just basic schedules put together. In this particular question, there's a dead giveaway as to what schedule you should use. You really shouldn't be considering other schedules. And what is that dead giveaway? Well, we know the behavior analyst is contracted out. But that's not what we're asking about. At the end of the year, they get with the owners and managers to plan the following year. And the owners and managers say they want to incorporate more choices for the learners. That is the giveaway as to what answer you should likely choose. If we look at A, a fixed ratio schedule, a fixed ratio is almost the opposite of choice, right? Because you're required to answer or get a certain amount of responses correct to get reinforcement, but you're not choosing between more than one thing. A mixed schedule, you have more than one schedule going on, but they're occurring randomly, right? They're swapping out, so they're not choosing what schedule. A conjunctive schedule, you've got two or more schedules, a interval schedule and a ratio schedule running at the same time, where you have to complete both schedules to get reinforcement. Again, not choosing. Concurrent schedules, however, have to do with that idea or the idea of matching law, where we are going by choice. You have two or more schedules running concurrently at the same time, and the learner can choose their preferred schedule, which makes it choice. And so if you're looking for choice, you are going to likely start by looking at a D, a concurrent schedule. Alfonso has suffered through migraines for the last 2 years. He is starting to believe that the migraines are related to the food he eats. Alfonso is a healthy person and follows a strict diet. He thinks the cause of his migraines is either the dairy, the sugar, or the fat in his diet and plans to remove one of them for a week and document what happens. What does this approach resemble? When we're talking comparative analysis, component analysis, and parametric analysis, don't think all the time in terms of ABA. And what I mean by that, and this is how you should approach most of these questions, is you can't just look at these concepts and ideas through the lens of ABA because on the exam, they're likely going to test you in other ways, right? They're going to want you to apply these concepts to other things outside of just your clinical practice. So in this case, we've got Alfonso who's suffered through migraines for 2 years, and he believes the migraines are related to the food he eats. He's healthy and has a diet. And as part of his diet, right, he still has dairy, sugar, and fat in the diet. So if we view the diet as the intervention, and Alfonso is going to take out one each week and see what happens, what approach is he using? A comparative analysis. Well, the comparative analysis, we're looking at totally separate interventions that don't have anything to do with each other, and they're not part of a package. Dairy, sugar, fat are all part of this package. So we're not necessarily comparing them. What we're doing is taking each of these components, because dairy, sugar, and fat are components of his diet, and then analyzing them separately. That is a component analysis. Think of these words, comparative versus component. With the component analysis, you're looking at the actual components of the intervention or the plan and analyzing each component. With the parametric analysis, that's when you've decided on the primary intervention or component and you want to know how much. So if Alfonso figures out, let's say, sugar is causing the migraines, he can do a parametric analysis to analyze how much sugar he needs to remove or maybe how much sugar he needs to eat. So comparative, we're taking two things unrelated, comparing them. Component, we're breaking down each component in a intervention or plan. Parametric, we're taking one of those and seeing how much. So what approach does this most resemble? Well, a component analysis. John's mom and dad report that reinforcement has been extremely effective a month after a parent training session where you demonstrated reinforcement to them. They tell you that they are consistently providing reinforcement each day just like you showed them. How should you verify this claim that reinforcement is effective? This is honestly not that difficult of a question. It's just worded a little difficult. And so, as always, we have to slow down and make sure we know what we're looking at and what the question is giving us. John's mom and dad are telling you reinforcement is effective, which is great, right? You demonstrated to them during parent training, it's effective. They're saying we're doing it every day just like you showed them. Now, can you take their word for it that hey, reinforcement is effective? No. Now, you can take their word that their day has gotten better or the behavior's better to them, but you have to verify that, right? You have to make sure it's actually occurring. And we can start with data, but how are we going to verify that reinforcement is actually effective? A, observe them implementing the reinforcement procedure. Well, just because they're doing the procedure correctly doesn't necessarily mean it's effective, right? We have to look at other things with consequences to make sure that consequence is actually changing the behavior. B, ask the behavior technician if they have seen a change in the client's response. Asking them is not going to hurt, right? You definitely want to know their opinion, but that's still anecdotal. That's still indirect. C, check the client's data following the introduction of the reinforcement procedure. Here we go, right? We have to look at data. We have to look, has the reinforcement actually changed anything? Or are we just imagining it, quote unquote, right? Or is it just their bias speaking, or is it a placebo, right? Where they just received this training, they did something different, and now they think everything's changed. The only way to verify that for sure, which is we're data driven, is to check the data. Data don't lie. And so when we check that data, it's going to tell us, is that reinforcement effective? Is it not? And then D, trust that the parents are doing it correctly so you don't damage your relationship with them. Yes, you want to have a good relationship with them, but you have to be honest with them. That's in the ethical code. And honesty involves verifying their claims, verifying anybody's claims for accuracy, validity, and reliability. If the data don't indicate reinforcement has worked, we have to call them on their statement that reinforcement is effective, go back to the drawing board and figure out how can we actually make reinforcement that's effective. So how can you verify that claim? C, check the client's data following the introduction of the reinforcement procedure. A behavior plan calls for reinforcement whenever Jeffrey is on task during group work. After 2 months, Jeffrey's on task behavior has increased by 100%. Since Jeffrey is now on task much more frequently than in the past, his teacher is giving considerably less attention to Jeffrey and paying more attention to other disruptive behavior. What is likely occurring as a result of the teacher's behavior? All right, a lot in that question, right? I even stumbled over some of it as I read. Long questions tend to do that. You zone out or you stumble. That's fine. We have to just go back and understand what is the question saying. So we're looking for the teacher's behavior and the result of the teacher's behavior. What is likely occurring? Well, we know the behavior plan calls for reinforcement whenever Jeffrey is on task. Okay, so after 2 months, Jeffrey's on task behavior has increased by 100%. That's great. But now that he's on task much more frequently than in the past, his teacher is now giving him less attention and paying more attention to other disruptive behavior. So what's likely going on? Before, Jeffrey's behavior was being reinforced for being on task, and now Jeffrey's more or less being ignored because he's always on task. So A, Jeffrey's on task behavior will only get stronger. Well, that's unlikely if nobody's paying attention to his on task behavior. Is Jeffrey continuing to get reinforcement? It doesn't seem like it. It seems like he's now being ignored. He's getting considerably less attention. B, Jeffrey's on task behavior might be on extinction. It's much more likely his behavior might be on extinction now. If she's not paying any attention to him for being on task, when previously he was getting all this reinforcement for being on task, there's a good chance or it's likely that his behavior is now being, or reinforcement is now being withheld for his good behavior. C, Jeffrey will become jealous of other students in the classroom. Well, we would never say that because jealous is a mentalism, right? It's a construct. And then D, Jeffrey's behavior is being punished. Well, that's unlikely. Nothing's being added or taken away. What's happening is Jeffrey's reinforcement is being withheld. Now, we can't know that for sure. We don't know what the reinforcement originally was. But based on the information, based on the answer choices, the best answer is that the behavior might just be on extinction. It's no longer getting praise. It's no longer getting attention. So Jeffrey's just on task, not receiving any reinforcement. Jeffrey's on task behavior might be on extinction. Alex is teaching an ethics course. To engage the class, he reviews case studies with them. He puts everyone into groups and has each group give their opinion on how they would handle the case study and then gives them points. However, groups only earn points if they give a different answer than the answer given before their turn. What type of lag schedule does this represent? All right, lag schedules. I put this in there as a teaching question. We don't talk about them much. They don't come up very often. Lag schedules essentially say if we are reinforcing every response, we're on a lag 0. It doesn't matter what the response is, lag 0. If you have to give a different response than the response before, that's a lag 1. If you have to give a different response than the 2 previous responses, that's a lag 2. So think something like categories, naming fruit. If I say apple, on a lag 0, I could say apple, 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 apple. Keep getting reinforcement. On a lag 1, I would have to say apple, switch it up. So apple, banana, then I could go back to apple. Lag 2, apple, banana, cantaloupe, and then back to whatever I want. So that's how a lag schedule works. So you just have to find out how many different answers before must there be. This one is a different answer than the answer given before. So really only one different answer prior, right? And so what type of lag schedule will that represent? Well, a lag 1. Don't get too caught up in lag schedules. I want you to be familiar with them, to know they exist, to understand them at least a little bit. Don't get too bogged down with this type of question, the lag questions. Just be familiar with the idea. Grayson enjoys taking baths, but will stand up in the tub when he is ready to get out. This poses a safety risk as Grayson could possibly slip and fall. His mom is teaching him to say all done when he is finished with the bath and reinforcing only when he says all done. What type of intervention is this? Okay, what are we doing here? What is mom doing here? We know Grayson enjoys taking baths, but stands up in the tub. Obviously, that's a safety risk, right? Soap, bubbles, everything else. Mom says, I'm going to teach him to say all done when he is finished and reinforce only when he says all done. So we've got a differential reinforcement procedure, right? Reinforcing something, putting other things on extinction. In a differential reinforcement question, ask yourself first, am I teaching a replacement? Because that answer is going to let you eliminate certain other answers. If you are teaching a replacement, then it must be an alternative or incompatible differential reinforcement procedure. If you're not teaching a replacement, then it won't be alternative or incompatible. In this case, are you teaching a replacement? Well, yes. What's the replacement? Saying all done when he is finished rather than standing up in the tub. So we know it's going to be a DRA or DRI. Now we have to ask ourselves, is the replacement behavior an alternative to the old behavior, or is it incompatible with it? Can Grayson say all done and stand up? He absolutely can. Are those incompatible? They absolutely are not, right? So you have to see the difference there. Alternative, we're just picking a brand new behavior. Incompatible, we're picking a brand new behavior that cannot happen at the same time as the old one. All done can be said while Grayson is standing up in the tub. So this is going to be differential reinforcement of alternative behaviors. What aspect of baseline logic and a withdrawal design seeks to confirm that the intervention is effective following the withdrawal phase? What aspect of baseline logic and a withdrawal design seeks to confirm that the intervention is effective following the withdrawal phase? I read that twice to demonstrate what I do sometimes when I read a question too quickly, or maybe I'm not paying attention to a question. Again, it happens. The biggest mistake you can make is think I've got to be perfect on this exam. You're not going to be perfect. When you get to a question, read it, don't even look at the answer choices, and understand the question first. So we know this is talking about baseline logic in a withdrawal design. Prediction, verification, replication. Which one of those three confirms that the intervention is effective following the withdrawal phase? Does prediction confirm the intervention? Prediction does not confirm the intervention. Prediction predicts the baseline, what we think baseline is going to do. Verification verifies our prediction of baseline. So that only leaves us with replication. Replication is when we withdraw our intervention and then replace the intervention, put it back so we can replicate, hopefully, our findings. So what aspect of baseline logic seeks to confirm the intervention is effective following the withdrawal phase? It's going to be C, replication. Excellent. Thank you for watching. Check out behavioranalyststudy.com for all of our study materials. Please like and subscribe. When you pass, let us know so we can include you in the Sunday shout out. Work hard, study hard. See you soon.